For the first time in history, a health crisis has shut down the entire global economy, painfully demonstrating how inseparable healthcare and the economy have become. In many ways, the COVID pandemic has pushed the healthcare systems in a direction diametrically opposite to what we have been taking over the past few years. For example, resources were focused on non-communicable chronic diseases such as diabetes and cardiovascular conditions. And similarly, the drive for efficiency shifted the care from hospital to daycare settings. The immediate impact at the height of the crisis was on the healthcare workforce. The challenge of ensuring their safety while maintaining the continuity of the service to the patients was enormous. The other major impact was financial, due to the stoppage of elective surgeries and procedures and the reduced footfall in the OPDs due either to restrictions of movement or the fear of cross-infection amongst the public. The current healthcare infrastructure is more towards integration of services, but COVID, being a communicable disease, has placed a huge emphasis on segregation. Currently, all hospitals have a separate access for ER only, with all other services having a common access. Future designs will consider this aspect and make appropriate changes. Secondly, the percentage of critical care beds, which include ICU, PICU, NICU or HDU to non-critical beds, will have to change. Currently, in a general hospital, on an average, about 30% of bed capacity is allocated to critical care. This, for example, in the US, at the height of the Covid-19 crisis, led to a significant shortage of critical care beds. One of the positives, if you can call it so, of this Covid-19 crisis has been the speed with which healthcare technology has taken center stage, and rightfully so. The advancements we have had in the last 6 months would have normally taken much more than that. Telemedicine, which has been there for some time now with teleradiology, moved rapidly to teleconsultations, remote monitoring in chronic disease management, and to the more advanced AI tools for prognostication, especially in epidemiology studies. The COVID-19 pandemic taught us many lessons and brought on many challenges, but it was heartening to see how diverse teams work together like family to tackle and handle such situations. From community to healthcare workers, from public to private organizations and NGOs, everyone has played an active role. Another commendable feature has been the exemplary role played by the government, and more specifically the successful public and private partnerships and the leadership of His Highness Sheikh Hamdan bin Mohammed bin Rashid Al Maktoum, Crown Prince of Dubai and Chairman of Dubai Executive Council. Now we are more confident that we can tackle such pandemics should the need arise.